This video was made possible by the Laurel Foundation, Bay Area Lyme Foundation, and the Limelight Foundation.
Some people do great on oral doxycycline. Some people need a year of IV antibiotics. Other people can do completely natural treatment.
I believe there is a time and a place for antibiotics, and that is really to be determined on how many infections someone might have, how long they've been infected, how long they're responding to the therapy.
For the pain that I experienced, it was more the antibiotics that really were the kind of first key to really getting me over that hurdle, that pain threshold.
After about the first year, there was a plateau, and I didn't feel as though I was continuing to progress. And at that point, I was really staying on the antibiotics more out of fear that if I stopped them, knowing that I was still symptomatic, that things would become worse.
We have had patients who have used antibiotics for very extended periods of time. And every time they try to get off the antibiotics, their symptoms relapse.
Ultimately, I was on antibiotics for 3 years. I still had some symptoms, and so we then went on to IV antibiotics for a period of about 9 months.
So it begs the question, are these antibiotics working to the extent that we expect them to? Or are they just creating a stalemate?
The first year was 100% antibiotics, but it took a full year just to turn the situation around. But by turning it around, I mean stabilized, I think, is the most positive thing I could say about it.
Antibiotics themselves are also fraught with problems. They cause oftentimes gastrointestinal distress, liver issues, bone marrow issues, every kind of issue under the sun.
With the antibiotics, I can remember just being really nauseous. I had a lot of stomach pain and discomfort, and it really knocked me out.
So in one hand, they're life-saving. On the other hand, they can be a curse. So there has to be a way to either shorten the time that patients are needing treatment or finding other treatments in parallel that work just as well, if not better.
I had decided to go against my gut feeling and was like, okay, let's start out with the antibiotics. I left that appointment with 4 different prescriptions for antibiotics.
And I'll never forget the first time she had her antibiotic injection, she was crying. She just said, I don't want to do this. But she did, and she had a pretty severe reaction.
2 weeks later, I started developing a rash on my legs. Big mistake on my end. And so continued taking the antibiotics, and this rash just continued to grow all over my body and get really angry. And it was really red, really blistery.
Her boyfriend and I had to treat her with a gel treatment at the hospital. From head to toe. She was very cute and said, here I am, all in my nakedness with my mom and my boyfriend. It was really an amazing moment.
I got to the point where I was really kind of starting to see progress with these IV infusions, that I was able to start what I call the miracle drug, which was a form of antibiotic that comes in injection.
And that's where it gets messy, right? We have data to say there's no evidence that extended antibiotic therapy makes any difference, right? There is data that shows that extended antibiotic therapy is making a difference. There is a tremendous amount of data coming out showing that this bacteria, Borrelia burgdorferi, is way smarter than we thought it would be.
And that was my turning point on when I really started to kind of feel like myself, my old self a little bit again. And that was a huge moment for me.